All right, so I chose to do my presentation on autism. Um, I chose to do this because I was diagnosed with autism at age 10. And later in life, by accident, I stumbled on a way to develop the ability to read body language and develop theory of mind, and some of these things you don't typically see in children who are on the spectrum. And so for the last 7 years, I've really been working on reviewing some of the literature and what we know, and coming up with a neural model based on that and some of my life experience. So a lot of what I did really was just observing people's faces consistently, and that gave rise to the ability to read social cues. And then I continued this on, and as I did that, I started to learn social rules, and I developed a theory of mind, and a lot of my sensory and fine motor issues actually went away. And so I hope you like my presentation, and we'll get started. So to begin, we need to learn a little bit of neuroanatomy. Some of this is a little bit familiar, but these are some of the areas involved in processing faces. So the first area and the first stop in processing faces is going to be the occipital face area, and it sits just lateral to the occipital pole. Another area that's especially important in processing faces is the fusiform face area, or the fusiform gyrus. And this is a lateral view. You can kind of see it there, but it's present on the underside of the temporal lobe. And then another important area is the superior temporal sulcus and the orbital frontal cortex, like we talked about in theory of mind and some of the other things we learned this semester. Another really important area that isn't specifically a face area but is involved in this and my theory is the voluntary fixation area and the involuntary fixation area. These are involved in being able to orient your eyes towards something, a person, an object, and then once you've oriented your eyes towards that object, being able to lock on and focus your gaze on that. So the voluntary fixation area is present in the front of the brain. It's much like the steering wheel in the car. It's what allows you to orient your eyes. And then the involuntary fixation area is a lot more widespread, and it's in the back of the brain. And it's not really like one brake, but multiple brakes in the car. Your gaze, what you're focusing on, is going to be processed in different areas, the temporal, parietal, and occipital lobe. So being able to lock on to like a face versus an inanimate object, or different things are going to be they're going to be processed in different areas of the brain, and that lock on is going to be processed by each of these individual kind of brake mechanisms projecting from the involuntary fixation area. So like I stated earlier, the first stop in processing faces is the occipital face area. And this contains a basic mental representation of a face, and it's what allows our brain to kind of create and perceive like that general shape and that general image. And if you remember from earlier in the semester, we learned a little bit about the law of averages and how humans find faces that are more representative of the collection of averages more attractive, because they match the mental representation we have in our brain. this is kind of the same thing, and that's what this area is responsible for. It's also interesting to note too that the human brain has areas like this for all aspects of the human body. There's clusters of neurons that we learned about in cognitive neuroscience a few semesters ago that will only be activated in response to the image of a hand. And the more human it looks, the more real it looks, the more activation you see, and the more cartoon and less defined it is, the less activation you're going to see. And so it's just a basic mental representation area that I think helps us be able to process that image of a face. The next area that's really important in facial processing is the fusiform gyrus, and it is very largely a pattern recognition area. It's involved in recognizing patterns and schemas of faces. The superior temporal sulcus um, that you saw, which was kind of right in the temporal parietal junction that was mentioned in the theory of mind presentation. This area is very important in joint attention, eye gaze, and lip reading. For those of you who don't know, joint attention is basically the process of two individuals orienting their attention towards an object so there can be a mutual exchange of information. The most relevant kind of example would be a child noticing that their parents were looking at something in particular, and the parent notices their eye gaze on what they're looking at, and then they can have a mutual exchange and be like, oh, you like that? That's a necklace or something, and it's involved in the child development process. Another area that's really important and really interesting is the amygdala. Most of you know that it is involved in emotion processing, especially negative emotions. What's really interesting about it is it, at least in adults, seems to be co-activated at the same time as the fusiform gyrus, the pattern recognition area, and there's bidirectional communication between the two via a white matter tract called the inferior longitudinal folliculus. And this is interesting because it's not that they're processing one aspect, that they're processing separate things. They're processing the same thing at the same time, and that bidirectional communication seems to give rise to processing the emotional kind of valence of faces. And it's the amygdala is activated only by emotional valence, not attention, unlike the fusiform gyrus. And it also enhances fusiform gyrus or fusiform face area activity when they're viewing a face that is displaying a specific emotion. So there's a lot of debate about the fusiform gyrus. It's largely considered a face area, but it is activated in other aspects of pattern recognition. It's just it's activated to a greater degree when looking at faces. But it's interesting because, and this is what they're thinking, is we spend about, like we learned in our book, about 30,000 hours by the age of 10 observing faces and socializing. And what they found is the more you focus on something that's processed in the fusiform gyrus, the more activation you're going to have in this area. And so that's why it's considered a face area, because that's something we attend to more. And this was kind of further proven in a study that showed experts in fields like bird watching. They showed greater activation for rare birds in the fusiform gyrus compared to people who aren't experts and don't look at birds and study birds as much as they did. So I believe that the ability to read emotions and body language on faces starts with a neural reflex loop. So far, we haven't really discovered any way, like we haven't discovered any method by which this develops. We just know developmentally that about 3 to 4 months of age, infants develop the ability to recognize emotion with specific expressions that they see on faces. And they also know that babies specifically love to look at faces, and they find it very rewarding compared to other stimuli. And so this is really important for my model. What I think happens, and the way uh, this nonverbal ability develops, is an infant will hear their parent's voice, and they'll orient their gaze towards their parent. And so this is facilitated by the voluntary fixation area, that steering wheel area I kind of talked about. And once they look at their face, the connection between the fusiform gyrus and the involuntary fixation area allows them to lock on. And once they've looked up at their parents and locked on, there's a biological reward in response to this that makes looking at faces more important and more interesting than looking at objects. And this is really important because infants can't modulate their attention well, and developing this ability is very, very important. So what happens is they look up, they lock on, and there's a reward, and so they continue to observe. And what they do is they begin to store patterns and schemas of facial expressions in the fusiform gyrus during these first 3 to 4 months of life. And once they do that, and they've built these basic patterns and schemes in there, an emotion can now be tied via the amygdala and that white matter tract we talked about to those newly formed patterns and schemas that are stored in the fusiform gyrus. And you can now tell that this face is angry, this one is disgust, this one's happy, and this one's sad. But prior to developing these basic schemes, there's nothing to associate an emotion to. So all the infant is doing is just observing and storing memory because it's interesting and it's rewarding for them to do so. And this is important because social skills and interacting with people is largely a perceptual skill. A lot of therapies with autism are oriented around teaching social stories, and they'll remember like the correct response and the correct answer, but they won't be able to apply it because they can't recognize the context of what's going on socially to choose the correct response. And developing this ability to read social cues, I think, gives rise to our ability to learn social rules, as long as we're constantly and consistently focusing on that aspect. So on top of this neural reflex loop, the connection between the involuntary fixation area and the fusiform gyrus allows humans to modulate their attention long enough to learn social rules. And a lot of that is cause and effect. I said something and I saw that another person was offended and their feelings were hurt. And my parents helped tell me that, oh, you shouldn't ask people if they're pregnant because they may not be pregnant and they may be self-conscious about their weight, different things like that. That's a lot of how learning social rules arises, and a lot of it's trial and error. You start to develop this knowledge around why you're seeing different emotions and different reactions, and you learn and try different things, and over time it gives you the ability to assess that, oh, this person is bored because I'm talking too much and I should maybe redirect a question towards them, versus they're bored because they're having a bad day or there's something else going on. And what I think goes wrong in autism is, like Mona talked about in her presentation, one of the major theories in autism is the overgrowth decline pattern. And that pattern tends to lead to distortions in specific brain regions. And one brain region that they often see abnormal structure with is the fusiform face area, or the fusiform gyrus. And there is a lot of research going into eye tracking and some of these nerve tracts involved in that, like the involuntary fixation area. So when you distort and you have an abnormally folded fusiform face area, it's going to impair the involuntary fixation area's ability to connect and interface with it, and as such it's going to distort that neural loop, so they're not going to as easily develop this ability to read body language. And then later on, just because you develop the ability to recognize an emotion, you still have to learn those social rules, and it very much comes from attending to faces, to paying attention to social things consistently for a long period of time throughout that interaction. And so that breakdown and that disconnect between these two areas, I believe, is how this, how we get the social delays that you see in autism. Another characteristic of autism is what they call repetitive stereotypical interests or movements. I like to call it stimming. It's a common term in the field. It's just basically they're playing with specific objects and sensory things like spinning plates, lining up cars. I have a client right now that likes to take the Nerf gun and drag it along the trampoline springs because he finds it, the vibration and the sound of it, rewarding. And most people, most experts will say, and the DSM will say, that it's an abnormal behavior. I don't believe that it is. I believe that this behavior specifically falls in line with Piaget's sensory motor stage of development, where infants and young toddlers are going along and they're stimming and building basic patterns and sensory schemes of different information that can be later tied to higher meaning, like language or emotion or things like that. And one really interesting pattern that I noticed is that in autism and typically developing infants, this behavior disappears once the child develops the ability to speak or expressive language. In autism, you still see that they may talk obsessively about a subject, but those sensory motor exploration things tend to disappear once they gain verbal skills and are no longer nonverbal. And what's more interesting is if you were to take a child who was previously nonverbal and diagnosed with autism to a new clinician and left out the fact that there was a language delay, their diagnosis would change to Asperger's. There's a lot of overlap in the symptomology, but the main difference really is that language delay. And so it's an interesting pattern that I'll elaborate on a little bit as we go on. I wanted to ask kind of just some hypothetical questions to get you thinking. So why does this behavior disappear after expressive language development, and why does it persist in autism well past the developmental timeline? Because you often see this stimming and sensory motor pattern in an 8, 9, 12-year-old who's still nonverbal or even older, but it goes away around 2 years of age in typically developing infants. And why does this occur in autism at the expense of joint interaction or social interaction with caregivers when they're exploring the world? What I believe that it is personally is this sensory motor pattern plays a role in language development. It's the very first step. It's much like nonverbal communication development. It starts with basic patterns and schemes. As you can see here, I have fur from a dog, a picture, an image of a dog, and a dog barking. These are all three very different sensory stimuli or memories that are associated with the same construct, a dog. And so early brain development, everything builds upon one another, and it starts with, in my opinion, building basic patterns and schemes. And if you look, these are some of the neuroanatomy kind of structures that are very much involved in language. This area right here is called Wernicke's area, and it is involved in the ability to recognize language, to recognize that this picture, this right here means fur, this is a dog, this is a bark. And just behind it, we have the angular gyrus. This is an association area, and it's involved in connecting Wernicke's area with aspects and parts of the temporal, occipital, and parietal lobe, which are main sensory lobes and where most of our basic kind of schemes and patterns are stored and processed. And so I believe specifically that these sensory schemes play a role in beginning the development of receptive language skills, because you can't associate something with something that's not there. It's the same concept as nonverbal development. You need these basic patterns and schemes to be able to associate them with a higher meaning and a higher order cognition. And so this process is largely facilitated by joint attention. And if you remember early on, that is processed by the superior temporal sulcus. And if you go back, it's interesting, the superior temporal sulcus, or more specifically the posterior superior temporal sulcus, is what's involved in joint attention, and it is directly in the kind of the same area as Wernicke's and this angular gyrus. But basically, like a child will explore his world, he'll stim on something, and a parent will say, "Oh, you like that?" They'll direct their gaze towards the same object as the child, and there's a mutual exchange, or vice versa. And because of this kind of joint attention process, children can move beyond the basic stimming or sensory motor kind of behavior and interact socially on that same object with input from the parent. And this helps the child learn language and learn to associate that this image, oh, is a dog, or things like that. I also believe it's important in expressive language, because that is when this behavior goes away specifically. And why I think that is because you have to build associations between the receptive part, the understanding language, and the spoken part. And all of these areas are very highly integrated. So Wernicke's area is directly connected to Broca's area via the white matter tract, the arcuate folliculus. And so this behavior of stimming and joint attention is what, in conjunction with some mirror neurons in Broca's area, which I'll explain in a minute, gives rise to the ability to name those specific objects and make the sounds of those specific sensory schemes and language and words associated with those. Sorry, I'm explaining this badly. It's a long day. So basically how this all develops is, first you build the basic sensory schemes, you store those in your brain from the sensory motor kind of activity and stimming. Then through joint attention, your parents help you kind of name and build associations and language meanings to these sensory schemes that have been stored in the brain. And then from there, as you engage in this same kind of joint attention and sensory motor activity, you look up at your parent and you see the way they move their lips and they say dog or duh or make these sounds. And the mirror neurons in Broca's area capture this this image of what their parents are doing, and they transcode it in a way that the child can copy that sound, that they can say dog or duh without having to think about how you access your voice box, how you move your tongue, how you move your mouth up and down, because it's a very complex thing and you don't think about it, you just do it. And that automation, I believe, comes specifically in mirror neurons from Broca's area. There has been some research into this, and they have proposed that mirror neurons play a role in language, but all of the studies I could find had been done on adults, and there didn't seem to be a lot of activation or a lot of purpose for the mirror neurons in Broca's area, and they kind of concluded that it must be just a fluke or something left over from evolution. I don't think this is true. It is true that mirror neurons in other areas of the brain are active and engage in this copying mechanism, this mimicking kind of mechanism that we learned about in our previous lecture. But specifically, the mirror neurons in Broca's area are present during these first early 2 years of life, and it helps the infant be able to program Broca's area to make the sounds necessary for speech and build associations and connections between the sensory scheme, the receptive meaning of that scheme, and be able to make the sound associated with that word and that receptive meaning. So where this goes wrong in autism is they have abnormally shaped superior temporal sulcuses, and they have problems with joint attention. So I think that this very much impairs their ability or delays it at least to develop receptive language. Because for a long time we didn't think they understood because they didn't necessarily respond to us and show us that they understood. We now know that almost all children with autism develop receptive language skills, and many of them do go on after a lot of practice and a lot of time to develop the ability to speak or develop expressive language skills. But this joint attention process is what helps facilitate and streamline building associations between sensory schemes when they stim and developing the meaning behind that. it's also, I do also think it helps with um, programming Broca's area, because all of these are interconnected, and to have the mirror neurons in Broca's area fire, the child with autism has to look up and they have to notice that their parent is naming this object that they're playing with, and saying doll, for example. And as they're playing with a doll and the parent is naming that, the mirror neurons can capture this image of what they're doing and automate the process of programming Broca's area to be able to make those specific sounds. And I believe that's where this language delay comes. It's also interesting, I found some studies where they have shown that, at least on the side for language, children with autism have abnormally shaped posterior superior temporal sulcuses, but you don't see that in Asperger's. And I think, and you don't see the mirror neuron deficit. And so that's why I think that is what the main kind of deficit is between autism and Asperger's, and it's what facilitates that language delay. This is just the same thing. They have the distorted micro columns of mirror neurons in Broca's area. So if we go back to these three questions about stimming and these repetitive movements and interests, the first question was, why does this behavior disappear after expressive language development? I believe it's because it's no longer needed. It's a reflexive behavior that helps program sensory schemes and is involved in this kind of reflex loop to help program and lay the foundation for these areas to be able to function properly as an adult. Why does it persist in autism? Because they haven't met that developmental milestone, and so that behavior is still needed to program Broca's area once they practice practice speech and things. And I didn't touch on this, I forgot, I'm sorry, but I think that you still can develop the abilities to speak, and I think this is what children with autism do. I think their mirror neurons don't always fire. They may a little bit, but a lot of it just comes from practicing, trial and error, trying to make those same sounds, because that automation process has been distorted. And the last question was, why does it occur at the expense of joint interaction or social interaction with caregivers? A lot of the social interaction that you see with caregivers is mediated by a reward. I think it's possible even joint attention in language also results in a reward. And because of that, the child, a typically developing child, finds it more rewarding to interact collectively with their parent versus stimming on their own. But it's still a normal behavior, and it's still a normal part of development. It's just the superior temporal sulcus and these reflex loops help bridge that sensory motor stimming with social interaction to help develop and program brain structures to do the specific things that they were wired to do. So I did mention at the start, there is something that is a little bit abnormal about the way children do interact and stim on the world versus typically developing infants. Children with autism tend to focus more on specific parts of objects rather than the whole object. Like I mentioned, the one client who will take the Nerf gun and drag it along the trampoline springs because he likes the vibration. That's not the normal function of what a trampoline would be or what a Nerf gun would be, but a lot of that is taught through joint interaction. And so part of it is they're not learning necessarily very early on the specific functions or big picture kind of aspects of some of these objects and what they're for, because of that lack of joint interaction. And some of it is due to, I think, an increased lateralization of brain processing. They have found this in individuals with autism, and part of it is because certain parts of the brain just progress farther than others. The social part of the brain is often stalled way earlier on than language or more logic kind of parts. And so to compensate, they'll activate that hemisphere more predominantly than the other one because they haven't developed the other hemisphere quite as much. And so that leads to focusing on specific parts of objects because there is a little bit of lateralization in terms of one side being specific parts of an object, like tires on a car, steering wheel, brakes, versus big picture, this is a car, a vehicle that can drive down the road and take you from point A to B. Another aspect of this is there's a lot of neural inflammation in autism, and they have a lot of cytokines, which are just chemicals that modulate the immune system and brain chemistry that are associated with OCD. And so that can contribute to some of the obsessiveness you see, just because this neural inflammation alters it alters like neurochemical transmission a little bit. Another thing is you see increased cortisol levels in autism, way more than their typically developing peers. And cortisol downregulates serotonin receptors, and a lack of serotonin has been linked to to OCD-like behaviors. And then one of the cytokines you see that's elevated is tumor necrosis factor alpha, and that decreases GABA as well and can contribute to that. You also see a lot of sensory motor issues in autism. They're very sensitive to specific stimuli. They don't filter out unwanted stimuli, and they get overloaded and overwhelmed very easy. They also tend to have a trouble with fine and gross motor skills, and they have trouble integrating multiple sides of their body, doing tasks that require you to use both your left and your right hand, or to cross over. And as I mentioned at the very start, a lot of this went away from me as my brain started to progress and develop those social skills. And so this is what I'm going to talk about and kind of explain why I think I saw my handwriting get better, my gross motor skills get better, and my sensory issues decline after I program these circuits. I believe that there's two separate brain processing patterns, one that you would see in infants and one that you would see in adults. As an adult, you've programmed each area of the brain. And cognitive neuroscience shows us that we perceive things as a unified whole, but there are multiple brain structures working together to process specific aspects of whatever it is we're doing. For vision, for example, there's object recognition based on the outline of a shape. And then there's a spot that processes color, and so on and so on. But we just perceive what we're seeing. We're not perceiving just one aspect of sensory information, but we have to program each of these areas. So as an adult, because every area has been programmed, your brain remembers what areas need to be activated when it comes across a familiar task. Like socializing, for example, it knows to activate areas involved for processing body language, understanding speech, and being able to respond. And it activates all of these areas simultaneously, and while at the same time it filters out unwanted stimuli. And you don't see that, I believe, in infants. So this is just kind of a picture of how some of this would kind of work in adults. Like I said, for socialization, you'd be activating Wernicke's area. When you're talking about a dog, to understand what a dog is, you'd be activating maybe some of the basic schemes that are there, and you'd also be activating Broca's area, your prefrontal cortex, to be able to respond to what they're saying about the dog you're talking about, as well as activating some of these other areas to monitor the body language of the other person, to know when they're done talking, to recognize maybe they're afraid of dogs, or maybe they love dogs more than cats. And so all of these areas will be collectively activated, but you're going to have the reticular activation system, which is in your brain, and it has multiple projections inhibiting other sensory stimuli, like the conversation a few feet next to you, or the fan that's going on above you in the room that you're in, and so on and so on. Infants don't have this ability, and they also don't have the ability to attend to specific things. A lot of what they attend to is based on reflexive behaviors that help kind of lay down the basic foundations to process stuff. And so because they haven't programmed each area simultaneously, they have to process one aspect of a task and then associate that one aspect with another aspect, and program each area in sequence on down the line. So an example would be, you'd program the occipital face area, and then you'd program the patterns and schemas of facial expressions, which then could be tied to an emotion, and the amygdala, and then you'd start learning social rules and storing them and being able to use all that information and assess it for tasks like mentalizing or theory of mind. But it all builds upon one another, and so infants can't filter out, I don't think, unwanted sensory stimuli. They're taking everything in because they need to learn everything, but they have specific reflex loops that make certain tasks more important than others, and allow for the caregiver to play a role in teaching them what is important, what you should focus on, what's dangerous and what's not, because that can change our environment, and those rules and different things can change over time based on the time we're living and the culture that we're in. And so I believe this plays a role in autism because they have this early brain processing pattern where they're having to process specific areas of a task at a time, and they're not filtering out unwanted stimuli. It's interesting, you'll notice kids with autism or ADHD or traumatic brain injuries, they'll tell you this. When they're talking to someone, they have to first think about what they're saying, then they have to think about their body language, and then respond. It's like there's a separate processing for each aspect of that task instead of integrating it collectively, which requires both hemispheres of the brain and multiple areas being activated at once. And this, I think, contributes to develop why children with autism get overloaded and have issues filtering things out. And I believe this specifically, this infant brain processing pattern is mediated by the primitive reflexes. So for those of you who don't know, the primitive reflexes are reflexes that help the infant survive. You have the moral reflex, so when they feel like they're falling, they'll have a surge of adrenaline and they'll tense up, so it'll help stabilize their spine. You have the suckling reflex to help them breastfeed, and then you have the reflex, I believe it is, where you touch the side of their mouth and they'll turn their head towards like the female's breast so they can latch on and breastfeed. But what's interesting, we know that these specific reflexes do those things, but they go away at certain in certain time frames consistently with typically developing individuals, and many of these time frames that they go away correspond to specific developmental milestones, which is why I think the primitive reflexes are what modulate this infant brain processing pattern and help make sure specific areas of the brain are programmed at a time and then integrate with other areas so it follows the correct pattern. And what they found is individuals with autism, ADHD, and traumatic brain injuries or tumors of the frontal lobe, they have a return or of these primitive reflexes, or they'll be there past when they're supposed to be. And it causes problems, as you can see, with hand-eye coordination, handwriting, fine motor skills, sensory things. And I believe it's because as an adult, you're activating multiple areas, you're integrating multiple hemispheres at once, and that just doesn't happen as an infant. You have to program certain areas at certain times specifically and have that information build upon one another and then connect between the two hemispheres and connect with each other, and they help set the pattern for how all of this kind of unfolds. And so the reason I believe they're present in autism is because they didn't meet the developmental milestones that correspond with their release. But in ADHD or sensory processing disorder, injuries of the frontal lobe, they also have found that they have retained primitive reflexes, and it interferes and causes some of the issues we talked about, like some of the fine motor skills or having to process specific aspects of that task. And I think the reason they have that issue is even though they may have programmed all of the areas of their brain, these reflexes return, and that pattern of having to process each task individually comes back. And there's a commonality that you see between patients with ADHD, sensory processing disorder, and frontal lobe injuries, and that's a decreased metabolism in the frontal lobe. Patients with ADHD tend to have a decreased metabolism in their frontal lobe, and I think some of it has to do with dopamine projections to the frontal lobe and activating that area for an increased metabolism. And then frontal lobe injuries, decreased metabolism, are tumors of the frontal lobe, and that's actually a diagnostic indicator. If you have a normal adult that has developed primitive reflexes, that's a sure tail sign that they could have a tumor or an injury to their frontal lobe, and they don't really know why that is as of yet. It's just a diagnostic indicator. So I think that because infants have a decreased kind of metabolism in their frontal lobe, it's not as active yet. That's what keeps these primitive reflexes in place and initiates that infant brain processing pattern, and results in some of these kind of struggles and deficits that you see. Basically, and one last thing, I think I accidentally deleted the slide that I was going to add, is even though kids with ADHD have retained primitive reflexes, they don't tend to get as overloaded as easy with individuals with autism. And I believe that's because individuals with autism have a lot more white matter tracts, a lot more connectivity, like 100 times more than kids with ADHD. So on top of not filtering things out, they're having a lot more input going to the brain, and they haven't developed some of the areas to process that, and that's why they get overwhelmed and overstimulated more so than kids with ADHD. But that's my presentation, and I hope you liked it. Thank you.